today at this Congress we are presenting our project we are conducting with the European Academy of Neurology. It's a really big project and consists of different parts, and we are responsible for one part of this. It means we are doing a study and we are going to expand it to multicenter level. The study named Burden of sleep-wake disorders, and we aimed to estimate the prevalence of sleep-wake disorders with such complaints as excessive daytime sleepiness and insomnia symptoms. And we want also to look a little bit deeper in this subpopulation to see how these symptoms impact their quality of life and health status. And also it will be one study group that, based on this data, will assess also socio-economic burden of these diseases. So we have one work package group that's working on systematic literature review, and we have already first results about insomnia, and we are planning also to go on with excessive daytime sleepiness. What we are doing in Switzerland is a pilot study. We already finished our recruitment phase, and we are going on with follow-up. And later on it will be a multicenter level. So till now we learned that excessive daytime sleepiness and insomnia in subpopulation at the primary care level is really a big problem. According to our data, it's 41% of this subpopulation that really reported the symptoms, daytime sleepiness or insomnia or both of them. And we see that still it's still under-recognized and undertreated. When we ask these subjects about the treatment, they are really worried about their symptoms. More than half of them said, yes, we are worried about their symptoms and we are looking for treatment. But mostly they have some over-the-counter medication like phytotherapy, and if it's prescribed from doctors, mostly it's old medication as drugs or benzodiazepines. And what we really wanted to see as a gold standard cognitive behavioral therapy of insomnia, it's really small amount of the patients that become this. So when we are planning this project, mainly we were thinking what is the reason that these disorders are so much under-recognized. And we found out that actually in the last years people are more and more concerned about sleep, they are more aware about sleep problems, and they address them to their health professionals. But still it's remained under-recognized. So we assume it can be really important to come to this first point of contact to the primary care physicians and try to figure out where is the problem and how we can improve it. So it's in plans. We collected the first data, and we need to work with experts in this field that they should really calculate this. And I think European Academy of Neurology, they have also one separate project about economic burden of neurological disease, and sleep-wake disorders are included in this project. As the next step, we are planning to complete the follow-up period. And after we collect all this data, we will analyze it and publish it. We are planning to go to the multicenter level after this pilot project in Switzerland, and we are really looking for different European countries. The idea is to compare different countries, let's say north part of Europe, south, east, west, to have different GDP probably of these countries, and to compare this. That's why we are looking for maybe interested persons who have some networking with the primary care level. We would be really pleased to collaborate, and if you have any question you can contact scientific department of EIN.